Dr. Igho Ofotokun, a professor of medicine at Emory University School of Medicine and an internationally renowned clinician-scientist, has dedicated his career to combating the long-term impacts of HIV, promoting women's health, and addressing inequities in biomedical research. He began his career as a medical officer in Nigeria in the 1990s. The AIDS epidemic was masked by social stigma, antiretroviral therapy was non-existent, and death following diagnosis was almost certain. Few men sought medical care for fear of stigma, but women often came forward as they wanted to live with their children and families. These women inspired his devotion to HIV medicine and women's health. Ofotokun started as a clinician with a passion for teaching, nurturing the next generation, and a strong desire and curiosity to understand the basic biology of the diseases impacting his patients. This passion fueled his translational research efforts on the burden of aging-related comorbidities. His team advanced the field and drew attention to populations at the margins of society at a time when few were focused on their health issues. The workhorse of HIV therapy used to include drug combinations that were associated with birth defects or stigmatizing changes in skin color that were unacceptable for many women. The robust studies he led influenced the U.S. Department of Health and Human Services and the World Health Organization treatment guidelines for people living with HIV. Devoted to his family, he enjoys hiking as a way to clear his thoughts and plan future research initiatives. Through his work, he has also expanded the visibility and representation of women and minorities in biomedical research. In his professional lifetime, a devastating epidemic that was destroying lives and communities across the globe evolved into a manageable chronic infection in which life expectancy now approaches normal. In presenting the 2024 Maxwell Finland Award for Scientific Achievement to Dr. Igho Ofotokun, the National Foundation for Infectious Diseases recognizes his contributions to bringing that once elusive goal of cure for HIV closer to reality.